Well, the past year or so has seen a revolution in terms of our understanding of Alzheimer's disease, probably greater than any time in the last 20 years, because we finally have a handle on how the different pathologies of Alzheimer's in the brain drive each other. There had been a lot of debate. Is it the plaques? Is it the tangles? Is it inflammation? And now we know that it's all three. That the senile plaques that form, the tangles that choke the inside of nerve cells, plus inflammation all contribute. What we've seen in the last year, and largely due to some studies we just did with creating Alzheimer's in a dish, so to speak, is that although you can get these tangles that kill nerve cells many different ways, including bangs to the head, concussion, a bad automobile accident, 5 unfortunate years of NFL football, that in Alzheimer's, it's decades of amyloid that makes up the plaques that causes the tangles to form. So that gives us an idea now of how to treat the right patient with the right drug at the right time. So today we can do imaging for amyloid and tell someone whether they may have more amyloid in their brain than they should at their age. I say that because at 40 years old and older, we're all developing Alzheimer's pathology in our brains. For a geneticist like myself, we don't think about whether you'll get Alzheimer's, but when. And right now, it's 50% of those at 85. And if you live to 120, it might be close to 100%. It's the amyloid accumulation in plaques that's driving the tangles. So if we can see amyloid early on, and we have a drug or a therapy that stops the amyloid, that's the idea, early detection, early intervention. We can also look in spinal fluid for evidence that the tangles are forming. So if you did a combination of amyloid imaging and look for evidence that tangles are forming by looking for those tangle proteins, the tau proteins in the spinal fluid, you can give someone an idea 15 years before symptoms that they're on their way. The way to treat this disease would be best to prevent it before it actually takes root. So we know that the amyloid that's initiating the disease, I like to think of it as amyloid lights the match. The tangles that kill the nerve cells are like a fire that spreads through the brain, because once you form tangles, they spread. And the inflammation, which is the reaction of the brain against this pathology, is fanning the flames. You need all three to get the disease. So you'd want to hit the amyloid early, 15 years before symptoms, hit that tangle spreading, the fire, pretty early. And for a patient who has the disease already, you want to stop the inflammation as well, because that's really what's taking out most of the nerve cells.